Commissioner Lisa Piercy. Following her remarks, we will have some time to take questions. We do have a short time today. We will end promptly at 2:30. If you do not get to ask your question during the briefing, please email that to us, pdhmedia@tn.gov, and we'll work on getting responses for you as quickly as we can. We will be using the raise hand function. I see we've got some people in the queue already, and we will take questions in the order in which they appear there. Dr. Piercy, we are ready for you, please.
Thank you, Shelly. Good afternoon, everyone. I do have a hard stop today. The governor and I do a monthly briefing of the congressional delegation. That's at 2:30, so I can't run over today, but I know I've got a lot of different topics today that many people will have questions about. I do commit to getting you answers as quickly as possible. So if we don't get to your question today, please send that an email because I want to answer them. I just can't run over today. So the top line today is that the Johnson & Johnson one-dose vaccine has been approved and is en route to Tennessee. We do expect 54,000 doses to arrive in state tomorrow. We then, after this week, expect to get no doses of J&J for the next 2 weeks. I believe I've told you this before, but we just got details about it today. So they signaled to us at the White House that we would get a certain amount and then it would go down and then go back up. We learned today that it's going to go down to 0 for the next 2 weeks. So we'll get 54,000 tomorrow, and then our next shipment is scheduled on the week of March 22nd. So that's okay. We can deal with that as long as we have visibility, but that won't be a steady supply until later in the month. The good news is that the J&J product is safe, it's effective. There's a lot of talk about the perception of this being a reduced efficacy vaccine. That's not the case at all. It is 100% effective against severe disease and hospitalization and death. That is exactly what we're looking for in a vaccine. I'm oftentimes asked if I would take that vaccine or if I would give it to members of my family, and the answer unequivocally is yes. And so you've heard me say before, the best vaccine is the one you can get the soonest. And so if you are offered the J&J vaccine and you want to take that one, I encourage you to do so. I also want to remind you that with the J&J product, we now have 3 vaccines, or will soon have 3 vaccines in state. I want to assure you that Tennesseans will have a choice. On the website called vaccinefinder.org, that shows where all of the sites across the state are that have vaccine in them. It also denotes which product is in each of those sites. I will tell you that the CDC has cautioned us not to mix and match products at the same site, particularly in providers that might not be as experienced. So there will be a few large-scale providers like hospitals, metro health departments, the ones that really are used to handling a lot of vaccine and have vaccine experts on board. They might be able to offer 2 different products, but the majority of sites are just going to have 1 product. And that is not only just for operational efficiency, but it also cuts down on the potential vaccine storage and handling errors. Now, speaking of vaccine storage and handling, that's something that is another really big benefit of the Johnson & Johnson product. You just put it in the refrigerator. It's very easy to handle. It doesn't have nearly the stringent storage and handling requirements that the Pfizer and Moderna products do. So it's going to be very well suited to get out to providers that don't have quite as much experience in handling vaccines, or maybe uncomfortable with some of the enhanced storage requirements. And it's also going to be a very good vaccine to vaccinate populations who are unlikely to come back for a second dose. Think about urgent care centers or emergency rooms or college campuses or anywhere where it might be difficult to get them to come back. Also, it's really well suited for large mass vaccination sites. It's a one and done, very quick and easy to transport out into the field. So I think you will see that in several different locations. I do want to tell you that there are a couple of mass vaccination events that are being planned for mid-March. A couple of those will likely have J&J product. You'll have more details about that closer to time. And then the other thing that we're working on that is scheduled to come online around mid-March, we've been working in a partnership with TBR, the Tennessee Board of Regents, which is essentially the governing body for higher education and community colleges, working with those sites to set up large drive-through mass vaccination sites on these campuses, not just for the people on the campus, but for the community. They oftentimes have a lot of parking lot and ways to drive through and put through a large number of cars. And so you'll see those sites being announced here in the next couple of weeks, but we've got several of those scheduled to come online soon. So speaking of vaccine supply overall, I mentioned that we have 54,000 J&J coming in this week. That is on top of what is now 192,000 of Pfizer and Moderna this week. So by the end of this week, we may have 250,000 vaccines in state for this week. Now, the next 2 weeks won't be quite as much because the J&J won't be there. But on a White House call this morning, we were briefed about what to expect towards the end of March. So the week of March 22nd, the week of March 29th, we've been signaled that there might be a lot of back-end loading for the month of March, and it could be as much as 30 or 40% increase in Pfizer and Moderna with the new Johnson & Johnson layered on top of that. So by the end of the month, it is plausible that we could be getting 300,000 plus vaccines per week. That thrills me to say because that's quite the opposite of what I was telling you just 30 days ago, where we were struggling to get maybe even 80,000 a week in the state. And so because of that increased supply, we are doing a couple of things. First, we are encouraging everybody to go to vaccinefinder.org and find a location that has vaccine. Don't get into the habit of thinking it's only at the health departments or only at certain clinics or hospitals. We have about 700 sites and about another 400 ready to come online when this increased supply, when we receive it in the state. So vaccinefinder.org can show you where the location is, and it can also tell you which product is available at that site. However, for our health departments, and I'm speaking specifically right now about the 89 rural health departments, we have over 200,000 available appointments open in the system right now. Now, they're not all this week or next week, but it goes all the way out to May. And so if people are worried about, well, I'm not going to be able to get an appointment, so I'm not even going to go on that site, I would encourage you to take a look. You might have to drive a little bit longer than you would normally have to, but there are 228,000 available appointments on that website. So that is on our COVID-19.tn.gov. You can go there and start that process. But also, the other thing we're announcing today is that effective Monday, March 8th, we are moving to our 1C population statewide. This is a massive population, and the reason we're going to go ahead and speed up and go to that phase is in anticipation for this large surplus of vaccine that we expect in the next 2 to 3 weeks. So as a reminder, the 1C population is all people age 16 plus with a high-risk medical condition. There's a long list of those conditions. It's in the vaccine plan, and it's on the website that Shelly just put the website in the chat box. But things like obesity and hypertension, COPD, diabetics requiring medication, there are a lot of people that will qualify in 1C of all ages. Now, from an age-based standpoint, we will continue to hold it at 65 plus on the age base, but beginning Monday, anybody with those medical conditions will be eligible to book an appointment. So I encourage you to do that. Like I said, that is a large population. We have estimated that to be in excess of 1.1 million Tennesseans. Unfortunately, we have high rates of many of these chronic diseases that qualify you for this population. And so we expect quite a bit of demand, and we're trying to match that commensurately with the supply that's going to be coming in the next couple or 3 weeks. Also, as a reminder, the last plan update included women who are pregnant or household contacts of pregnant women in 1C, as well as household contacts of high risk or medically fragile children. So the children under 16 who aren't eligible to get the vaccine because they're too young, their household contacts can get that vaccine in order to offer that child some protection. I want to shift now and give you an update on the Shelby County situation. I want to alert you that the CDC team arrived Sunday night and came into Shelby County Health Department alongside us on Monday morning. Our teams continue to work together there. I believe there is a team of 3, perhaps 4 CDC representatives with us. And we're currently working with the CDC team to piece together all available points of data to try to ensure the temperature integrity of the vaccines that have been given in Shelby County. You've heard me reference that one of the major issues there was some lack of record keeping, or lack of consistent record keeping, I should say. And so we are taking all the data available to us on the digital data loggers, on the temperature logs, the transport logs, and putting all of these together to try to ensure vaccine stability based on the temperatures that we know about. We know that there are some vaccines or some vaccines that at a point in the process, we don't know the temperature, and that's why we have looped in the Pfizer scientific team. So almost all of these vaccines that we're talking about that have had issues in Shelby County are Pfizer vaccines. So we have incorporated the Pfizer science team because they have a lot of data based on the stability of their product at different temperatures. That is a very painstakingly long and detailed process. And so the teams on the ground are going through that line by line so we can ensure that those vaccines were in temperature. Now, let me transition and tell you what happens if they're not, because we've gotten a lot of outreach over the last 4 or 5 days, many points of contact from just constituents and citizens of Memphis and Shelby County saying they believe they've gotten an expired vaccine, or expressing concern, what's going to happen to me if I did get an expired vaccine. So let me break down both of those points. We are aware and have received many examples of where people were given a sheet of paper when they got their vaccine that had an expiration date on there that was before the date they actually received the vaccine, sometimes a week or 2 more or more. And right now, we're taking every one of those very seriously. We're looking into that and making sure that we can verify temperature stability on all of those doses. But we believe the majority of those are from a clerical error that occurred in the Shelby County Health Department. I won't bore you with all the details, but essentially a lot of the sheets were printed up and the newer ones just weren't taken to the site. That's an overgeneralization, but that's the kind of clerical error I'm referencing, is that they actually weren't expired. It was just the clerical error in the papers that were taken to the site. We are not resting on that assertion as a final decision. We are verifying those ourselves, but the vast majority, I think, of those are a clerical error. But we are still having a lot of concerns from people saying, what happens if I got an expired vaccine? This is really important. Nothing bad is going to happen if you get an expired vaccine. The worst thing that can happen is that it's just not as efficacious. It's just not as effective as a temperature controlled or unexpired vaccine would be. I think people are getting confused, thinking that this is somehow contaminated or that it's spoiled and it's going to cause harm. That is not the case. If you were to receive an expired dose, it doesn't mean you're going to be harmed. It just means it might not be as fully effective as one that was in proper temperature the entire time. We are not ready yet to say how many, if any, were out of temperature. That's that very painstaking process I was describing, but I want to reassure your listeners and viewers and readers that this is not something that is going to cause them harm. It's just something that may be less effective than what they were expecting. And then finally, you will be getting this in a release at the conclusion of this briefing today. But I want to hit a couple of highlights of what we're doing as far as checks and balances. You know, we've had a couple of providers in the state that have had some expired or wasted vaccine. And so it's a legitimate question to say, hey, what are you guys doing to make sure that's not happening anywhere else, or that it doesn't happen in the future? I want to remind you that vaccine management is not new to the department, and it's not new to health departments anywhere. We have for decades administered the VFC, or Vaccine for Children's program. That is the program where the federal government provides us vaccine for childhood immunization. And the process for storing and handling vaccines on a good day, even outside of the COVID vaccine, is pretty standard. And so the COVID vaccine does add a layer of complexity because of the cold, ultra cold chain. But vaccines are something that health departments have been doing for years, and it's something that our program here at the State Department of Health has been monitoring for years. And so on a routine basis, we have routine, very detailed on-site quality assurance visits every 12 to 24 months with all of the sites, depending on what kind of site they are. But we have the ability at any time, because we are the administrator of this program, to go in and do spot checks, or we don't really use the term audit, that's kind of a business principle, but quality assurance, clinical checks, and go in and making sure that those are, that everything's being done correctly at the site. And so because of what happened in Shelby County and then a couple of other incidents in the state, we are accelerating that timeline and going to complete one of those detailed reviews of all metro health departments by the end of this week. Some of those are already in progress or complete, and we're projected to have all of those at the metro health departments done before this week is over. And then just again, as another spot check, for the 2 to 3 weeks following this week, we will be doing that same process at all of our rural county health departments. And there are a lot of layers that are baked in already with regional immunization coordinators and interactions with the state. But I want to reassure you that we're taking it seriously and doubling down on our efforts to ensure compliance. We are also adding a couple of features that will help providers, particularly providers who aren't as adept at handling vaccine. It's not part of what we call the bread and butter of what they do every day. A special phone line for storage and handling questions, as well as some enhanced education in the onboarding process, including a little quick start reference guide. And then finally, on an ongoing basis, we're looking to contract with a healthcare quality assurance company to go out and help us kind of be our arms, our hands and feet, if you will, out in the community and out in the rural counties and in the metro counties to do QA checks on these providers so we can identify any issues early and minimize any potential future wastage or spoilage. So I've taken up 20 minutes with my comments today. We'll leave the last 10 minutes for questions, and then what we don't get to, happy to answer those by email. Shelly?
Yes, our first question is Caleb Kern from WCYZ.
Yeah, Dr. Piercy, I was going through the Vaccine Finder website today and spent a couple of hours calling each of the local pharmacies, and it turns out that a good number of them haven't even started giving vaccines, haven't gotten their first doses, or even available for appointments. And so I was wondering why that is that they're on the website. And then second, is there any idea of simplifying the process by having the community providers use that same statewide list that the health departments are?
So on the Vaccine Finder website, that is actually a federally managed and controlled website. And so I believe they populate that list on providers that have been onboarded and are ready. I will tell you there is another category where some providers actually have vaccine in hand, but their processes are not yet robust enough to turn it on publicly. They're either waiting on their scheduling to get their scheduling platform to get ready, or they're holding it for a big event. Lots of different reasons for that. I think that will be remedied in the coming week or two, but that's a federally managed software program that we really can't control. We just tell them who in the state is eligible to receive that and is ready. The second question that you had, I think was similar. Did I just answer the second question for you?
No, I was asking if there was any consideration of having that statewide sign-up list that the health departments use, of integrating the community partners, so there's just one place.
Yeah, that's great. Yeah, I wasn't sure which list you were talking about. So you're talking about our scheduling platform at the 89 rural county health departments. We call that VRAS, VRAS. That right now is available in all 89 rural health departments. And then we have a schedule of bringing that system online in each of the metros. The next one, or the first one to come online, is scheduled to be Shelby County on March 15th. So that's in about 2 weeks. You'll remember we identified a couple of little minor issues when we first rolled out that system. And so we've been allowing the software company, which is Microsoft, to fix those for us before we push this out at scale. A little problem in rural county health departments will get really big really quickly when pushed out in a large metro. And so we're working through that. Scheduled to do Metro, the Shelby County Metro Health Department on March 15th. And then I believe Nashville is next up after that. That will not be a platform where community providers can be scheduled, because there are so many different kinds. For example, we have product in all or 130 out of 150 Walmarts. Walmart has their own corporate system. Hospitals have their own system, oftentimes through their electronic medical records. And then there are lots of different independent providers that have their own system. So the VRAS scheduling system from the state will be health departments only, now rural and soon to be metro.
Thank you. Our next question is from Alexandria Adams at WSMD.
Our questions. Two questions for you. Why were Williamson County teachers shorted 1,000 doses? They were anticipating 2,000 doses a couple of days ago. And also wanted to know which counties will receive the J&J vaccines first.
So there were a lot of counties statewide, still are a lot of counties statewide, that the whole county allocation is not enough to cover every teacher in 1 week. I know it's convenient and it's highly desired for schools to be able to do all of their teachers and staff all in one event. Our supply is still such where that's not practical for the whole county, because remember, each county just gets a population-based allocation. So all of the schools, and Williamson County is not the only one, all of the schools will get enough for their teachers. It's just not all coming in 1 week. Your second question, I'm doing a really bad job of remembering second questions these days. Tell me that one again. Sorry about that.
No problem. Just wanted to know which counties will receive the J&J vaccine first.
Sure. So because of this thing that I told you earlier, where we're trying not to mix and match different products at the same site, all of the rural county health departments have Pfizer or Moderna right now. So they're probably not going to get any Johnson & Johnson at the rural county health departments, because they're using the products that are a little bit harder to store and handle because they're vaccine experts. So the J&J product will likely be pushed out to other large sites for high throughput events. So many of our metro partners are going to get the J&J product because they're going to have large drive-through events. Those TBR sites at the community colleges that I referenced will likely get those. And then the J&J product later in the month, when we get more of it, will be pushed out to providers who are onboarded and waiting on product, but currently have nothing. So we want to give them that because they don't have anything right now.
Thank you.
Our next question is from Kimberly Crucy with the Associated Press.
Hi, Dr. Piercy. My question, I wanted to return back to the issue of wasted doses. Last February or this February, we saw 3 major incidents where the doses were either had to be unused, expired, et cetera. I was just curious to kind of get your thoughts on whether or not you thought Tennessee had an issue with wasted doses, and how can you assure the public moving forward that what happened in February isn't going to happen again?
Sure. It's a legitimate question and certainly one that should be considered. I think we're dealing with two separate things here. So the Shelby County incident you're very familiar with, there were some systemic issues there in the process. Both the Knox County issue and the Rutherford County issue appear to be a one-time human error. So it doesn't really indicate to us that those particular sites were subject to this larger systemic issue, but because of it, we are, and that's why I'm providing it to you in a release today, are kind of stepping up our efforts to do quality assurance and spot checks and random audits throughout the state with all of the providers, because we are having more providers come on board that are not used to handling vaccine. And that's a good thing and a bad thing. It's a good thing because we want more sites. And you've heard me say many times that we're trying to get as many sites and have as much access and reduce barriers, particularly in the vein of equity, as we can. But then again, we also know that there is a little bit of an enhanced risk when you give this very precious and fragile commodity to a provider that might not be as adept at handling them. So the short answer to your question is we don't believe there's a systemic issue statewide, but we're ramping up our efforts for compliance just to be sure.
Thank you. Our next question is from Jessica Jagloy at WNC.
Yeah, I have a question about this. You all provided this piece of paper last week, and we wanted to know, are all of these doses that were written on this piece of paper, were those expired in the pharmacy, or did any of these make it out into the field? And I have a follow-up as well.
Sure, and I've got my piece of paper here to write second questions now. So that's a good question on those expired doses. We believe that all of those expired in the pharmacy and never went out into the field. But let me tell you a little nuance there, because I'm sure that when people see the lot numbers on that log that we got, they automatically look at their card to see if they got one of those lot numbers. I don't know how many are in a lot, but it's hundreds or perhaps even thousands in a particular lot. So just because there were, for example, 165 doses in a particular lot that is expired, there could have been several hundred that went out into the field that were perfectly fine. So to answer your question, those expired in the pharmacy and were not out.
Quick follow-up. So people, of course, they're seeing their lot numbers and they are concerned. How are expiration dates determined in Shelby County? And we see again that, do you think that's part of the record keeping that the county had an issue with?
Yeah, and that brings up a good point. And I just glanced at the clock, so this will have to be my last answer. But that brings up a good point of how do we define expired? And we might be talking about a little bit of a different thing than what you normally think of. So I think when people think of something that's expired, they think of the date on a gallon of milk or, on a box of medicine, that it has passed that date. That's actually not what we're talking about here, because many of the dates on the vials were several months out. We're talking about it being expired or spoiled, if you will, after it's been out of the freezer too long. So when you take it out of the freezer, you have 120 hours to use it. And after that 120 hours, it is considered expired because it's been out of the freezer too long. So that's what we're talking about in Shelby County, not that the actual vial was expired itself. All right, I'm going to have to jump off here, and
Really
I know lots of people have their hand raised. Please email, and we'll be happy to follow up with you then. See ya. Bye.
Thanks, everyone. You may send your questions to tghmedia@tn.gov. I know we've had several people with questions. We'll get to those as soon as we